If you are watching this, you probably know the routine all too well. You wake up at 2 a.m., then again at 4 a.m. You stand over the toilet waiting for something, anything, to happen, and when it finally does, the stream is weak and hesitant. That is the frustrating reality of living with benign prostatic hyperplasia, or BPH. It drains your energy and disrupts your life. But for many men, the solution has felt almost as bad as the problem. You go to the doctor, you get a prescription, and suddenly, you are trading your urinary problems for dizziness. You stand up too fast and the room spins. You feel tired, foggy, and unsteady on your feet. It feels like a terrible trade-off, fixing your bladder by sacrificing your stability. But what if I told you there is a new generation treatment available? A medication designed to fix the flow without tanking your blood pressure? Today, we are talking about a specific molecule that is changing the rules of the game for prostate treatment. It is an update that many have been waiting for, and it addresses the biggest complaints men have about traditional therapy. For decades, the gold standard for treating an enlarged prostate has been a group of drugs called alpha blockers. You might know them by their generic names like tamsulosin, doxazosin, or terazosin. They are the first line of defense, and to be fair, they work for millions of men. They relax the muscles in the prostate to help urine pass through. But they often come with a heavy price tag on your quality of life. The biggest and most dangerous complaint is hypotension, low blood pressure. Why does this happen? Well, these older drugs are a bit like a shotgun blast. They target the alpha receptors in your body to relax the prostate, which is good, but they aren't perfectly precise. They also hit the alpha receptors in your blood vessels. When your blood vessels relax too much, your blood pressure drops. For a man in his 40s, maybe that is just an annoyance. But if you are over 60 or 70, it is dangerous. A sudden drop in pressure when you stand up, what doctors call orthostatic hypotension, can lead to falls, fainting spells, and serious accidents. In fact, this side effect is the #1 reason men stop taking their prostate medication. They simply cannot function while feeling lightheaded all day. The medical community knew we needed something better, something more precise. Enter the new contender. The molecule is called silodosin. Depending on where you live, you might see it sold under various brand names, but the active ingredient is silodosin. Now, while we are presenting this as a new option for many, it is important to clarify that this isn't experimental. It has been approved by the FDA in the United States and used across Europe for over a decade. However, it often sits in the shadow of the cheaper, older generics like tamsulosin. So many patients have never heard of it. But it shouldn't be ignored. This isn't just another prostate pill. It represents an evolution in how we target the problem. If the older drugs were blunt instruments, silodosin was designed to be a precision tool. It was engineered specifically to solve the blood pressure problem while maintaining, or even improving, the urinary relief. To understand why this matters, we have to get a little technical for a moment, but I promise to keep it simple. It all comes down to selectivity. Your body has receptors called alpha-1 receptors. Think of them as light switches. When you flip the switch, the muscle tightens. The goal of these drugs is to block the switch so the muscle relaxes. Here is the catch. There are different types of switches. There are alpha-1b receptors, which are found in your blood vessels and control your blood pressure. Then, there are alpha-1a receptors, which are found almost exclusively in the prostate and the bladder neck. Older medications like doxazosin are not very picky. They act as non-selective blockers. They block both switches. They relax the prostate, which helps you pee, but they also relax your blood vessels, which drops your pressure. Even tamsulosin, which is considered a better drug than doxazosin, still affects the blood vessels to some degree. Silodosin is different. It is what scientists call ultra-selective. It is a highly specific antagonist for the alpha-1a receptor, the one in the prostate. In fact, scientific data shows that silodosin has an affinity for the prostate receptors that is approximately 162 times greater than its affinity for the blood vessel receptors. That number is huge. It means this medication effectively ignores the blood vessels and goes straight for the prostate. It is like using a sniper rifle instead of a shotgun. It hits the target you want, the tight muscles in the prostate, and leaves your blood pressure regulation system alone. This effectively minimizes the risk of that dizziness, lightheadedness, and fainting associated with the older generation of drugs. Let's look at this practically and compare it to what you might be taking now. If you are prescribed a drug like doxazocin, your doctor usually has to play a game of titration. You start with a tiny dose, wait a few weeks, check your blood pressure, increase the dose, and repeat. It takes time to find the level that helps you pee without making you pass out. With silodosin, because it is so safe for your blood pressure, there is usually no need for this adjustment period. You take the full therapeutic dose from day one. You don't have to ease into it. And what about effectiveness? You might think that because it's safer on blood pressure, it must be weaker on the prostate. Actually, the opposite is often true. Because it binds so tightly and specifically to those prostate receptors, it is incredibly potent at relaxing the bladder neck. Many clinical studies and meta-analyses suggest it provides faster and more significant relief of urinary symptoms compared to its predecessors. It works fast, often providing relief within hours or days, not weeks. For an elderly patient or anyone taking medication for hypertension or heart issues, this safety profile is a game changer. You get the relief without the risk of falling in the middle of the night. It allows you to treat the prostate without destabilizing the rest of your cardiovascular system. However, in medicine, there is rarely a free lunch. We have to be completely honest about the side effects because silodosin does have a very unique one. Because this molecule is so incredibly effective at relaxing the bladder neck, that's the muscle that holds urine in, it causes a phenomenon called retrograde ejaculation. This happens to the majority of men who take this specific drug. Normally, when you climax, the bladder neck closes tight so the fluid goes forward and out. But silodosin keeps that muscle wide open to help you pee. So, when you ejaculate, the fluid takes the path of least resistance and goes backward into the bladder instead of out. You still have the sensation of an orgasm. The climax feels exactly the same, but nothing comes out. It is often called a dry orgasm. Now, this can be terrifying if you don't know it's coming. But is it dangerous? Absolutely not. The fluid just mixes with your urine and you pee it out later harmlessly. It doesn't hurt, it doesn't damage your kidneys, and it doesn't ruin the physical sensation of pleasure. It is purely a mechanical issue. The only time this is a real medical problem is if you are trying to father a child. In that case, this drug causes temporary infertility because the sperm isn't exiting the body. Once you stop taking the medication, everything goes back to normal. But if you are done having kids, this side effect is actually a sign that the medication is doing exactly what it is supposed to do. It is relaxing that obstruction in your bladder neck maximally. Now, while we are on the topic of sexual function and keeping your plumbing healthy, I know that for many men dealing with prostate issues, maintaining strong, youthful erections can also be a major source of frustration. You want to fix the flow, but you also want to keep the fire alive in the bedroom without relying on dangerous blue pills or weird gadgets. If you are looking to turn back the clock on your performance, there is a fascinating presentation I want you to see. It details a bizarrely simple, 100% natural, 7-second morning ritual involving a specific purple tonic. It's helping thousands of men stiffen their soldier and regain the stamina of their 20s by targeting the root cause of dysfunction, a specific enzyme that blocks blood flow. Take out your phone and scan the QR code you see on the screen right now to watch the video that explains exactly how this works. If you can't scan it, don't worry, I have also pinned the link to this video at the very top of the comments section below. Go check it out. It might be the game changer you've been looking for. So, is silodosin the right choice for you? It might be, especially if your main struggle with current treatment is side effects. If you have tried tamsulosin or doxazocin and hated the dizziness, the fatigue, or the low blood pressure, this new generation option is a fantastic alternative. It offers powerful, rapid relief for your urinary flow while keeping your cardiovascular system stable. The trade-off is the dry orgasm, but for many men, trading a bit of fluid for a good night's sleep, a strong stream, and a steady walk without dizziness is a deal worth making. As always, you need to have a real conversation with your urologist. Do not just stop your current meds. but bring this up. Ask them if silodosin is right for your specific anatomy and medical history. Knowledge is your best prescription.